Thank you. I thank the organizers of the event. On behalf of Dr. Rogelio Rangel, I request for an apology. She had unforeseen events and she had to travel to Chihuahua to take care of matters of the regional office. She was ready and here to present this, but she had to leave yesterday. We are speaking about the actions of collaboration to favor healthy lifestyle focused on the border area of Mexico and the U.S. First of all, it is necessary to describe and define what the border is about. The Mexican-U.S. border is a region where both nations interact. On the Mexican side, it consists of 80 municipalities in 6 different states, and on the U.S. side, it consists of 48 counties equivalent to Mexican municipalities in 4 counties. The region also includes several Native American people like the Yucapá, Quiligua, and Kumeyaay natives, and small settlements of Mixteca and Zapoteca indigenous people, mainly in Arizona and Baja California. This causes particular challenges with regard to health systems to serve these populations. In demographic terms, the border region has had a very accelerated growth in the last years. By 2010, 7.3 million inhabitants in the border municipalities in the northern Mexico had been registered, and in the U.S., 7 million in the border counties in the U.S. For Mexico, 37% of the population in the border states was located in the border municipalities. Ciudad Juárez, Tijuana, the biggest urban areas in the region on the Mexican side, have 40% of the population of the border municipalities in the northern area of Mexico. On the other side, there is El Paso, which are the main urban centers on the U.S. side, with the highest population in this region. The border states in the U.S. have almost a fifth of the country's population. This causes very particular challenges. However, the border is neither homogeneous. On the Mexican side, we know that there are higher levels of development, employment, and also of income, and turns this region in an attractive focus for international migration. On the U.S. side, in the southern states and in the southern counties, we have the highest concentration of poverty and disparities in access to health services. This causes, as already mentioned, particular characteristics in the health map of the region, like high levels of chronic diseases and infectious diseases, and also much difference in the access to services. Child obesity is an issue that has become important in the last years. We know that the border states in northern Mexico, the child diabetes prevalence is higher than in other areas of Mexico. And only to provide a context where we have the ticks, the marks, there we have offices operating for our commission. 6 offices on the Mexican side in the most important cities in that border area, and another 7 offices on the U.S. side of the border. In their efforts to continue to reduce these health issues in the border region, the Border Health Commission has started two initiatives to monitor health. They called them Healthy Border 2020. These programs for a healthy border are binational programs to promote the prevention of diseases, focusing the attention on regional matters and on bilateral and community plans for health. This initiative is established in the framework of the program Healthy People HIH in the US and the Health Indicator Program in Mexico. The Healthy Border Program considers the main health issues that affect the region, which are presented in the first column, where obesity and diabetes have received a lot of attention because of their condition, and these are the current prevalences. Among the projects to be performed jointly by the US and Mexican part of the Commission, we have all this series of activities that have been performed in 2013 and 14, and there's also a technical binational group for the prevention of obesity in the border region. 2020 evolves from the identified problems and the background of Healthy Border Area 2020, and currently is summarized in 5 lines of actions, where again chronic and degenerative diseases are of vital importance. In particular, there are some priorities that have been developed under the 2020 Healthy Border Project. Health issues related to chronic and degenerative diseases, obesity, diabetes, and heart diseases, and projects being developed to serve this population is a technical binational group for the prevention of obesity in the border area, and all the other initiatives developed in the framework of the Binational Commission focus on the detected needs. For example, there's the Binational Border Health Week, and we know that degenerative and chronic diseases are important here. We have also a program, an educational program for leaders, cross-border leaders, and they receive issues and subjects as students, and this year we carried out programs associated to obesity and diabetes for them to develop leadership skills. Some specific actions that have been developed and promoted by the Commission to serve the needs of obesity and diabetes over the last 5 years are these. We don't have detailed data. We wanted you to know the work that is being performed, and one of our challenges we currently have at the Commission is to assess the impact of all these interventionist programs. Sometimes it might seem they do not provide results, but they do, because they are part of the Healthy Border program and are taken care of by Mexico and the US alike. In 2009, in the Baja California section, we carried out a research program to diagnose obesity and overweight in primary and secondary education schools at the request of the Ministry of Health of the state in collaboration with the Health Institute staff. It doesn't explain much more about the Commission, but the Commission consists of health ministers of the border states in the US and Mexico, and the commissioner of both sections for the Commission are the federal health ministers. In Mexico, we also have a representative who is the director of international relations of the Ministry of Health, And closing the brackets, I continue to talk about the initiatives. We have a binational multimedia campaign on diabetes and obesity, which was linguistically, culturally appropriate. Why do we have to adjust these campaigns? Well, given the dynamics of the border, perhaps children live in Tijuana, but they spend most of their day in San Diego going to school. It's not all of the population, but important percentages. And you cannot only focus on the labor force only, because people are living in San Diego and go to work to Tijuana and vice versa. So it's important to take into consideration these cultural and linguistical aspects. Other projects that have been established were the identification of excellency models and successful models in the region, searching for mechanisms to replicate them. Based on this, we did a diagnosis of diabetes and obesity in the region for children and teenagers. Also, within the binational Border Health Week, the healthy lifestyle activities are promoted, such as walking, health fairs, cycling, dancing. And during this year, a first regional meeting between the US and Mexico took place to present the 5 steps for your health program with representatives of the health sector from both sides of the border. In 2010, we had an interesting event which was much satisfactory for us, took place in Ciudad Juarez at a health food fair where students and the families were invited to develop and present a nutritionally adequate dish that was assessed by nutritionists. Additionally, the interaction between children and the parents was promoted, and this was a substantial part of the score. And 18 modules were also within the promotion of a healthy lifestyle. The inclusion of all age groups took place with working trips starting in modules in Ciudad Juarez, where students received information and sports training, aerobics and Tai Chi lessons, and this included self-help groups of elderly groups. We also performed a workshop on the 5-step health program in Tijuana, focused on health staff and nutritionists in the region. In 2011, other projects that took place or were developed were, among others, a monitoring of child obesity and overweight in the state of Nuevo León, where the Border State Commission contributed with supplies. As I mentioned in the beginning, not all initiatives have been developed by the Commission, but the Commission searches to carry out actions, so they promote them and support them with supplies sometimes. In the first year in El Paso, Texas, a forum on child obesity was carried out together with the Nuevo Mexico, Texas, and the regional office in Chihuahua developed the Health Week in the border area. And they asked binational health commissions to participate. Along the border, there are well established in the El Paso and Ciudad Juarez and also Sonora and Nogales region. We have binational health councils, which are local efforts focused on health priorities which are urgent. We have a very successful case, the Health Paso del Norte effort Cobina, which took place in Sonora and has worked over 50 years in these type of issues on both sides of the border. So jointly we have to solve these issues and work on them. In 2013, A small fora took place in Texas on obesity in the border region, and as of this event, a Mexican-U.S. border conference was proposed that also took place that same year in Texas. The obesity conference suggested to continue to promote the best practices and binational programs to solve this problem, and to continue to work with private and public organizations and those interested in the promotion of health and development of healthy lifestyles, to promote physical activity and healthy culinary habits, and to recommend items for politics. And very importantly, what arose from this prevention group of obesity in the border area is that they had their first meeting in 2014, and the target or the objective of this group was to create a space for experts and those interested in these issues in order to define long-term action plans, such as a workshop, a planning workshop. We had the opportunity to have the support of Kaiser consultants who help us with strategic planning and identification of what are the guidelines we have to follow and the actions we have to perform. Because over time we have seen that there are many agents, many organizations, but often, even if we do have a framework for our activities, the interests of each organizations are different, and sometimes we do not fulfill the basic objectives. So a strategic planning program has been much useful for us. In 2014, we also had a collaboration in a much more active way with the municipality of Tijuana. The latter has a program called Together for a Healthy Tijuana, which is a program that focuses on fostering healthy habits. And over the year, they have organized 3 hikings, health fairs, and they also give courses on nutrition, and they also have instructors for physical activity. And one essential element of this program is working with the educational sector. So a basal study is being performed to identify nutritional health status of primary school children, and actively the Commission is proposing an assessment of this program because it has been in place for 2 years already. This is an initiative together with the municipality and the School of Medicine of the San Diego University, and the program called CATCH to serve children's health needs. This is an international program, but it is located, is headquartered in Texas. Other actions the Commission has developed to solve these issues is the installation of migrant health modules. Migrant workers are for the border region a population segment that is not protected. This is a vulnerable population that has to be served immediately, and together in a study together with the University of Madison and the Commission to analyze risky behavior for infection of HIV and AIDS, and also of social conditions and health conditions, we detected what are the priorities to serve these populations. So since 2012, we have a module at El Chaparral at the border crossing, and we are working together with the National Migration Institute. And in Tijuana, the border crossing was remodeled, and the delegate approached our commission knowing the work we do, and they offered us a workspace within their offices in order to open our migrant health module there. We have a physician and 12-hour service because repatriation takes place during that time frame, and we have health promoters that inform about healthy lifestyles among this population. We also measure we give advisory services on diabetes. We are currently working in Tijuana, Matamoros, but we are planning on, and we have received requests by the federal government to provide migrant health services along the entire border. Next year, we hope to open modules in Nuevo Laredo, Nogales, and Reynosa. We have worked in Mexicali, but there were complications with our offices, so we do not operate there. But we will start operations in these modules. We proposed to serve migrant workers at the spots where they are being deported, and we have been much acknowledged for this model of work. Much of the information we had about the health needs of migrant workers and comes from the information obtained from the health offices program, which is called Ventanilla de Salud, which is coordinated by the Ministry of Health and for the Office of Foreign Affairs, and is worked on in consulates, and they provide informative services. The goal of Ventanilla de Salud is to increase migrant workers' health information, because oftentimes their access to health services in the U.S. is difficult, and in the U.S. it's a good which is sold at a high price. And we know that our migrant workers don't have access, and we also want to inform them about prevention and alternatives which are cheaper, and this has been much useful for this population. The two general components of this model are that we know that migrant workers, when they change physically, their behavior and their lifestyle changes. So this turns into a risk factor for certain diseases. At the same time, the environment changes for them, and within the social control models, the fact that they are not being seen and they are not being told, or our relatives are not there to control us, it's easier for them to undertake actions that might affect their health. We also know that the condition of Mexicans in the U.S. are often causes of death such as obesity and diabetes. And this is all on my side.